We're happy to be joined by Dr. Anthony Fauci this morning, who is getting ready to step down from government service after decades on the job. I appreciate you joining us this morning. Thank you so very much.
Good to be with you. Thank you for having me.
You know, years ago, you used to come on and join us and talk about whatever infectious disease was in the news and the headlines, and we have always appreciated that over the years. And then COVID came along, and suddenly everyone in the world knew your name. Everybody was talking about you. You've had decades at the job, and it kind of seems like COVID is defining your legacy at this point. Do you agree with that, and are you okay with that if that's the case?
Well, for the people in my field who know me prior to COVID, that COVID does not define my legacy. My legacy is probably much more defined by the 41 plus years that I have been working on HIV, developing the drugs that have led to essentially transforming the lives of persons with HIV to lead essentially a normal lifespan, and the work that I did with President Bush to be the principal architect of the PEPFAR program, the President's Emergency Plan for AIDS Relief, which has resulted in saving more than 20 million lives. The people who are understanding public health and the history of public health know me well beyond the 3 years of COVID. But the general public who didn't really know or care much about what we did with regard to HIV and Ebola and Zika and all the other things that I've been involved with, you're right, they know me only in the context of COVID and the attention that has been put appropriately on COVID. But so there are two groups of people. There's the general public and there's the people in the public health field and the scientific fields who know me much more than just for 3 years.
Dr. Fauci, speaking of those 3 years, looking back, all of the advice that you'd given in regards to the pandemic, anything that you regret or that you would have done differently? Obviously, hindsight is 20/20, but knowing what you know, anything you would have done differently?
Well, I think you said something very importantly. This is a dynamic, moving target. What we know and knew in January of 2020 is different from what we found out as the weeks and months went by into February, March, April, and then with the variants that came in and the appreciation that the virus is spread by aerosol, it's very highly transmissible, and that 50 to 60% of individuals who transmit it when they have no symptoms. Of course, had we known all of that in the beginning, there are many things we would have done differently with regard to the recommendations about masking and about physical separation and things like that, of course.
I'm curious, as a scientist, you look at things one way, but now the world looks at everything a different way, and kind of jumping off where Jeannette was going with this question, if you can't go back and change things, right? But you have people who will consider you a hero for what you did, and you have people who will say, I don't like that guy because of what you may have done or not done. How do you compartmentalize all of that, and how do you deal with that now as you transition into retirement?
Well, I mean, I don't think I have much trouble dealing with it. If you look back at the track record, everything that I've ever done was in the purpose of preserving and protecting the health of the American public. I promote people getting vaccinated. I promote people wearing a mask in an appropriate setting. I promote people getting tested in certain circumstances in order to protect the people around them. Those are pure public health principles. The people who would hate me for telling someone they should get vaccinated or telling someone to wear a mask, it doesn't bother me at all of that, because that is based on things that are completely contrary to science. So I don't have much trouble with that. No. And I'm not running a popularity contest. My job is to help preserve and protect the health of the American public, and everything I've done in that regard has been for that purpose.
I'm curious, and I know you don't often get too personal. While it appears that you can compartmentalize very well, I know you had mentioned in the past that, I mean, there were threats to your family and just personal impacts. What toll, if any, has this had on you and your family, folks who are anti-vaxxers or anti-maskers and don't like you and take it to the next level? What impact has that had?
Well, I obviously don't like it. I think that anyone who, and I mean, first of all, the reason they're doing it is by a combination of conspiratorial theories and out-and-out anti-science, anti-vax approaches. For those people who have a problem with my saying that people should be getting vaccinated and then harass and threaten my wife and my children, I mean, the only thing that you could describe that as just being pure cowards to do that. I mean, that is so completely preposterous to do that. You know, I mean, I'm not concerned about my safety. I have federal agents with me all the time because of threats against my life. So I don't think about that. But of course, I don't like and I'm, I would say, disturbed by the cowardliness of people who are harassing innocent young women, i.e. my daughters and my wife. I mean, just think about that for a minute. What kind of a total coward would do that? And they do it.
I'm sure the last thing that you would have thought about getting into the field of medicine was having to have security, federal security, following you around to protect you and your family. So I want to take this on the opposite aspect of things, Dr. Fauci, and on a personal level as well. But this on the good side, right? Because along with the bad came a lot of good. You suddenly were thrust into the spotlight. You did have a chance to have some celebrity moments. You got to be with a lot of interviews. You had celebs immediately in your cell phone. Got to be portrayed on SNL, throw out the first pitch at the Nationals game. Maybe I shouldn't bring that up. I don't know. I'm sure it was still a thrill for you, but you got on a baseball card. What was it that stood out from that chapter of life that maybe you got to enjoy and say, you know what, I will take some good with the bad here?
Yeah, I don't look at it that way at all. I mean, it's nice that some people, you know, idolize me and put me up on a pedestal, but I don't get impressed by that. I never have. People may not understand that or believe it, but I focus like a laser beam on what my job is. And as I said before, and I mean that sincerely, and my track record has proven it, my job and my mission is to preserve and protect the health of the American public. I pay as little attention to the people who are saying they're trying to kill me as I do with the people who make, you know, put my face on donuts. I mean, to me, I don't get distracted by either of those.
With you stepping down from public service after so many decades, I'm sure you've seen with AIDS and other diseases and viruses many medical advances. What's the next frontier when it comes to medicine and infectious disease?
Well, in my own field, the unfinished business that we have is there are still very important killers of people throughout the world for which we don't have completely adequate interventions. For example, we desperately need a very good vaccine for malaria that kills over 600,000 people, mostly African children and babies. We need a vaccine for tuberculosis, again, which kills 1.6 million people each year. And we want a vaccine for HIV. We've done spectacularly well with HIV in developing a combination of drugs that winds up essentially transforming the lives of persons with HIV and allowing them to lead essentially a normal lifespan. But we still would benefit greatly from a vaccine from HIV. And that's one of the things that I think is in the frontier in the future that hopefully will accomplish those goals.
One more medical question, and then I have a personal question for you coming up. But on the medical front, along those lines, it seems like after COVID, and obviously we're still in the midst of it, but once we, I guess, kind of got used to the attention that we brought to COVID and it just consumed us 24/7. Now looking forward, whether it's RSV now, which is getting a lot of attention, other medical issues seem to get a lot of attention, maybe just so in the media, maybe people are talking about it. Did COVID help as a whole to make us more aware of health and disease, or did it have the opposite effect? I'm curious your take on that.
I think it's a mixed bag. I think people are very aware now that infections are important and they can kill you. They've seen it in a very, very dramatic sense with COVID, which has already killed 1 million Americans, more than 1 million Americans. So when you talk about a spike in RSV, which is very problematic for young children, usually less than 5 years old, or the elderly, or a very bad flu season, I think people are more aware of the fact that serious infectious diseases can have an impact on society, and hopefully that will allow them to do what needs to be done to mitigate against that, like get vaccinated. But on the other hand, the mixed bag that I'm talking about, that this confrontation that we've had with COVID has also generated a lot of anti-science, conspiratorial disinformation going on, mostly through the social media, that sometimes gets people have the opposite effect, namely to not want to get vaccinated and to have an anti-science approach. That's what I mean by the mixed bag.
After so many years of working hard, especially these last 3 years, I mean, my goodness, I'm sure working around the clock. How does one relax? Is it hard to do that? Is it hard to just afterward just unplug? What does that look like as you're stepping down here?
Well, when I unplug, I'll let you know, because I haven't done it yet.
I was going to say, you're still speaking very diplomatically, but soon this government service will come to an end, and you hopefully can relax a little bit. Last question for you. We've known you as Dr. Anthony Fauci for decades here in D.C. Long before that, there was little Tony Fauci on the streets of New York. How do you think he would respond to where your career has evolved over all these years as you get set for retirement?
Well, I think he would have been excited about the things that I've had the privilege of going through. And if as you said, the little Tony Fauci on the streets of Brooklyn was to be able to look at the future, I think I would have looked at it with a very positive flavor to it, that I've had the privilege of being involved in some important things. And I think that that's something that I would have appreciated as a child, and I certainly appreciate it now.
Well, we appreciate your time now. I'm just going to assume that it's time with family is next for you when you get into the private sector?
Well, there'll be more time with family, but I'm not retiring in the classic sense. I'm still going to be doing a lot of writing, a lot of lecturing, and advising in an advisory capacity. So retirement is not the right word. I think it's sort of like a redirection or a rewiring of what I do.
Can we expect a book, by the way, of your experience over the last 3 years or more?
I'm sure that sooner or later you'll see one, yes.
I have no doubt you'll work it in with all the lecturing and everything else that you'll be working on. Listen, not just today, but we appreciate your time over all the years and decades here at Fox 5. Thanks so much for joining us once again, and we wish you the best.
My pleasure. Good to be with you. Thank you for having me.
Thank you.